Hello, my name is Erin Mahoney, and today I'm going to be conducting and explaining a complete horse health check on my friend Count right here. So when you are a caretaker of a horse, it is extremely important that you know their normal behavior, routine, personality, stall habits, eating habits, bathroom habits, their typical vitals, so that you can notice when they're abnormal, if something is off, if their general appearance is off, their general behavior is off, so that you can notice that there's a problem, identify it, and fix it. So, for example, like if your horse typically eats all of its food and you notice that they have food left over in their feed manger, that's abnormal behavior for them, and you might want to look into that and see if there's something wrong, or if they haven't gone to the bathroom that day, or if your horse is normally super bright and expressive in its stall, but they're acting real lethargic and tired and just unusual. That's another example of that. So for the sake of today's video, when taking Count's vitals, I'm going to just start from the front of his body and work my way to the back. But if this was a real life situation where he was expressing a certain problem, then I would first look at the vital that would tell me more about that problem. Like, for example, if I saw that he was exhibiting signs of colic, then I would immediately listen to his gut sounds first. But so just for today, since this is purely educational, we're just going to work from the front to the back. And an overall thing to consider throughout the entire process of checking your horse's vitals is to make sure that you are keeping yourself and your horse and any handlers that may be helping you safe at all times. So this means never standing directly in front of or directly behind the horse, making sure that they know you are there at all times so you're not surprising them or sneaking up on them, making sure you have a well-lit area, plenty of space, in a place where they feel comfortable and it's quiet. So the first of my vitals that I'm going to check are Count's mucous membranes, and these can be found in the lining of the eye, but it is a little bit easier to check them on the inside of the mouth, right above his teeth on his gum line. And so what we're checking for here is healthy blood flow and hydration. So what we're looking for here is I'm going to feel his gums here, and they should be pink in color and moist, which they are, which is a good, healthy sign, which indicates that he has good hydration and healthy blood flow. Okay, so while normal mucous membranes should be pink and moist, some other possibilities, if they were like a fiery red color with a line through it, that could indicate a fever or infection. If they were yellowish, that could indicate jaundice. If they were like dark red or bluish purplish, then that could indicate a lack of oxygen. If they were really pale, that could indicate anemia or shock. Or if they were dry, then that could indicate dehydration. Okay, so the next vital that I'm going to be checking is capillary refill. So again, we are going to be looking at his gums, and this time I'm going to take 2 fingers, my middle and pointer finger, and push down on his gum line and pull my fingers away. And when this first happens, because of the pressure, where I was touching is going to turn white. And then once that I pull away my fingers, the color is going to return or refill back. The amount of time that it takes for that color to return would be the capillary refill time. And ideally, if the horse has proper circulation, that will be less than 1 to 2 seconds for that color to return. If there is an issue with circulation, then it might take longer for that color to return. So I'm going to now demonstrate this. So I'm again going to open up his mouth and take my 2 fingers and push down and see it go away. 1, 2. 1, 2, and then the color returns, which indicates that he's got good circulation. So the next vital that I'm going to be taking is the skin pinch test, we call it. So this is to check for hydration level. So I am going to be looking at Count's neck, and I'm going to be conducting this test right at the center of the cone of the neck, or the triangle of the neck, which is surrounded by the nuchal ligament, cervical vertebrae, and the scapula. And right at the center of them, I'm going to take my thumb and pointer finger and just pinch the skin and then pull it away. And so since his skin flapped back to being flat in under 2 seconds, this indicates to me that he is well hydrated, because if the skin took longer than 2 seconds to return to normal after being pinched and it stayed like tented up, then that could indicate that he is dehydrated. I'm gonna do it one more time. You can see 1, 2, and it's back to normal. So that means he's well hydrated. I am now going to be checking Count's pulse. So ideally, on a horse, you want their pulse to be 30 to 42 beats per minute. And in order to check this, I am going to take 2 fingers, my middle and pointer finger, and stick them under his jaw or mandible on the maxillary artery. And once that I can feel the pulse, I am going to tell my assistant to start the 15-second timer that we have set. And I'm going to count out loud each time I feel a beat. And then at the end of those 15 seconds, my assistant is going to tell me to stop. And then whatever that number is at the end of those 15 seconds, we are going to multiply by 4. And then that will give us the total amount of beats per minute. Okay. I'm going to take my pointer finger and my middle finger and stick them on the maxillary artery. And I am going to count out loud every time I feel a pulse beat. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Stop.
Okay, so in 15 seconds, I counted 10 beats. So if we multiply that by 4, that would equal 40 beats in 60 seconds, which is within the normal range of pulse for a healthy horse. So now I'm going to be checking for a bounding digital pulse. So basically, if I am able to detect a digital pulse in Count's leg, then there is likely inflammation in the hoof. If there is no inflammation in the hoof and there is no problem, then the digital pulse should be undetectable. So in this inflammation of the hoof, if there was a digital pulse, that can be caused by a hot nail, an abscess, an injury, laminitis, and some more things. But ideally, you do not want there to be a digital pulse because you do not want inflammation in the hoof. So to feel this, I'm going to come down here, run my finger along here. It's just right around the fetlock area here, right here. It's on the digital artery, and I do not feel a pulse, but I'm going to wait a couple more seconds just to be sure. But I still do not feel a pulse, which is good. This means that there is likely no inflammation in his foot. All right, that was a good sign. The next vital I'm going to be checking is heart rate. So I'm going to use a stethoscope, and I'm going to hold it up to on Count's left side, on his chest wall, right on his heart girth, kind of right behind his elbow right here. I'm going to listen to his heartbeat, and I'm going to set another 15-second timer. And once that I can hear his heartbeat clearly, I am going to start the timer and count out loud each beat that I hear. And then the number that I get at the end of those 15 seconds, I am again going to multiply by 4 so that I can get the total amount of beats per minute. And ideally, on a healthy horse, the heart rate will be 30 to 42 beats per minute. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Stop.
So in those 15 seconds, I heard 10 beats. So 10 times 4 would be 40 beats in 1 minute, which fits within the normal range. Here specifically is where I am listening to the heartbeat, right here on the left side of his body, on his heart girth, right behind his elbow. I'm now going to be checking Count's respiratory rate. So to check respiratory rate, I'm going to watch his flank area, and I'm going to watch it expand and contract. Each time this happens, I'm going to count that as 1 breath. And I'm going to set another timer for 15 seconds, 30 seconds actually, and I'm going to count the amount of times I see this expansion and contraction, and then multiply that by 2 so that I get the total amount of breaths per minute. And ideally, on a normal, healthy horse, this should be between 12 to 20 breaths per minute. This could, of course, be elevated sometimes if they just exercised or they're excited, it's feed time, something like that. And it is more reliable to watch their flank expand and contract to take respiratory rate than it is to watch their nostrils, because they do more with their nostrils, like sniffing and expressing things, so that it's not as reliable to look at their nostrils for breaths. Okay, start the timer. 1, 2, 3, 4, 5, 6, 7.
Stop.
So I got 7, and so that's 7 breaths in 30 seconds. So 7 times 2 would be 14 breaths per minute, which fits within the 12 to 20 range. So the next thing I'm going to be checking are gut sounds. And so gut sounds are assessed by listening to the 4 abdominal quadrants, so the upper and lower on each side of the horse. And ideally, we want to hear intermittent gurgling sounds all the time. If there is no sounds when we try and listen to these quadrants, then that can be a sign of an impaction colic. If there is a pinging sound, it can be a sign of a gas colic. If there is a sound like running water, then this can indicate hypermotile or overactive gut. In the case where the horse is actually showing signs of colics, of colicking, you must be super careful when doing this, because it is going to be right by their belly and their legs area. But since Count is not doing that, I should be all right. I'm still going to take caution though. So I'm going to listen to each of his abdominal quadrants for around 15 seconds, just to be sure I can actually hear the gut sounds that I am looking for. So I'm going to start by listening to the upper left quadrant. I hear gurgling. I still hear gurgling. good. So now I'm going to listen to the lower quadrant. Oh. Oh yeah, I hear gurgling there too. Lots of gurgling. Okay, that indicates a normal gut so far. And I'm going to come over to the other side and listen to the upper quadrant on this side. Oh. Oh. I hear gurgling. Okay, that's good. And now I'm going to listen to the lower quadrant. Oh, and I hear gurgling here too. So since I am able to hear intermittent gurgling in all 4 of Count's abdominal quadrants, that tells me that his digestive system is working good and his gut is moving normally. Okay. So lastly, I'm going to be taking Count's temperature. And before we take the temperature, it is important that every time we clean the tip of our thermometer, which we will be inserting in him with some alcohol, which I have already done, especially if you're going from horse to horse. And it is also important to put some Vaseline onto the insertion tip of the thermometer so that it does not hurt him going in. And so this is a digital thermometer, and I am going to turn it on and just wait for it to be ready. Okay, and I'm going to stand off to the side over here, let him know I'm here. Try not to get kicked. I'm gonna practice caution here because some horses might not like this. And I'm going to pull his tail towards me. And now I'm going to insert the thermometer into his rectum about 2 to 3 inches in. And I'm going to wait until the thermometer beeps and tells me that it has read his temperature before I pull it out. There we go, it just beeped. And it says 98.8 on it, which normally their temperature, you want it to range from 99.5 to 101.5 degrees Fahrenheit. But I do know that Counts normally runs around this temperature, slightly lower than normal. So that I know that is normal for him, so that is not concerning. But an elevated temperature could indicate fever, infection, other problems, overheating. If he did have a super low temperature, it could be that he's cold also. He is body clipped. And we have his sheet off for the sake of the video. But now after this, you want to make sure that you thoroughly clean off this thermometer before using it on anybody else. But that is our final vital sign. I actually ran the thermometer underwater first because it was particularly dirty. And I also poured some alcohol onto this napkin, and I'm going to make sure that I thoroughly clean the tip of it so that it can be used next time on another horse. Thank you for watching.